Asbestos awareness is critically important in construction because asbestos, a known human carcinogen, was extensively used in building materials like insulation, floor tiles, roofing, and cement products until the late 20th century, and still lurks in many older structures. When disturbed during renovation, demolition, or maintenance, asbestos fibers can become airborne and, if inhaled, lead to severe, often fatal diseases such as mesothelioma, lung cancer, and asbestosis, which may develop decades after exposure. Because asbestos cannot be identified by sight alone and requires professional testing, proper training, handling protocols, and regulatory compliance are essential to protect workers, occupants, and the public, making asbestos awareness not just a safety best practice, but a legal and ethical responsibility in the construction industry. Asbestos is a naturally occurring fibrosilicate mineral that was widely used in UK construction until the late 1990s due to its fire resistance, strength, and insulating properties. Under the control of Asbestos Regulations 2012, the key legislation enforced by the Health and Safety Executive, HSE, asbestos is classified as a Category 1 carcinogen, meaning it is known to cause cancer in humans. The three main types found in UK buildings are chrysotile, white, amosite, brown, and crocidolite, blue, all of which pose serious health risks if fibers are inhaled, potentially leading to mesothelioma, asbestos-related lung cancer, asbestosis, or diffuse pleural thickening. The HSE mandates that anyone working in construction must be trained to recognize potential asbestos-containing materials, ACMs, avoid disturbing them, and follow strict control measures, including risk assessment, licensed removal where required, and use of appropriate personal protective equipment, to ensure compliance and safeguard health. Asbestos remains a major health hazard in UK construction because, despite the ban on blue, crocidolite, and brown, amosite, asbestos in 1985 and a complete prohibition on all asbestos types by 1999 under the control of Asbestos Regulations 2012, hundreds of thousands of buildings, especially those constructed or refurbished before 2000, still contain asbestos-containing materials, ACMs, such as insulation boards, pipe lagging, ceiling tiles, and textured coatings. When these materials are disturbed during routine maintenance, refurbishment, or demolition, microscopic, airborne asbestos fibers can be inhaled and become trapped in lung tissue, leading to severe, irreversible diseases including mesothelioma, a rare and aggressive cancer of the lung lining, asbestos-related lung cancer, asbestosis, scarring of the lungs, and diffuse pleural thickening. These conditions often have a latency period of 15 to 60 years, meaning individuals may feel healthy for decades before symptoms emerge, by which time the diseases are usually advanced and incurable. Because there is no known safe level of asbestos exposure, the Health and Safety Executive, HSE, stresses prevention through asbestos awareness, proper surveying, risk assessment, and strict control measures as the only effective way to protect current and future generations of workers and building occupants. Workers across a wide range of construction and maintenance roles are at significant risk of asbestos exposure, particularly those involved in refurbishment, repair, or demolition of buildings constructed before 2000, the cutoff year after which asbestos use was fully banned in the UK. This includes electricians, plumbers, joiners, gas fitters, shop fitters, roofers, plasterers, demolition workers, surveyors, painters, and decorators, all of whom may disturb hidden asbestos-containing materials, ACMs, while drilling, cutting, sanding, or removing building components. Critically, anyone working near ACMs, even if not directly handling them, can inhale dangerous fibers if proper controls aren't in place. Moreover, without strict adherence to hygiene protocols, such as using designated workwear, avoiding dry sweeping, and using HSE-compliant decontamination procedures, workers can unknowingly carry asbestos fibers home on clothing, shoes, or tools, potentially exposing family members and colleagues to secondary, or para-occupational, exposure, highlighting why asbestos awareness, training, and preventive measures are essential for everyone on site. Under the control of Asbestos Regulations 2012, the primary legislation governing asbestos management in the UK, all construction and maintenance workers who may disturb asbestos-containing materials, ACMs, must, by law, receive appropriate information, instruction, and training, commonly referred to as asbestos awareness training, aligned with HSE Guidance Sheet EM2. This training is not optional, it is a legal requirement designed to help workers recognize ACMs, understand the associated health risks, and know how to avoid or safely manage exposure. For higher-risk activities, such as removing sprayed coatings, asbestos insulation, or lagging, work must only be carried out by HSE-licensed contractors who follow strict controls, including enclosure, air monitoring, and specialist respiratory protection. Proper training ensures that everyone on site can contribute to a safer working environment, prevent accidental fiber release, and comply with their duties under the law, ultimately protecting not only themselves but also colleagues, clients, and the public from the long-term dangers of asbestos exposure. In the UK, asbestos-related work is categorized based on risk level, which directly determines the required controls and whether HSE licensing is needed. Maintenance work, such as drilling, painting, cleaning, or minor removal of asbestos-containing materials, ACMs, is typically non-licensed but still requires asbestos awareness training, a risk assessment, and basic control measures like using PPE and dampening materials to suppress dust. Removal work, especially when part of refurbishment or redesign projects involving higher-risk ACMs, e.g., insulation, sprayed coatings, or pipe lagging, often requires HSE licensed contractors who implement stringent safety protocols, including enclosures and respiratory protection. Encapsulation, applying sealants to bind asbestos fibers and prevent release, is a control method used when removal isn't necessary, but it still demands trained personnel and ongoing monitoring. Finally, air monitoring and sample analysis are specialist activities conducted before, during, and after asbestos work to verify airborne fiber levels and confirm material types. These must be carried out by competent, often accredited, professionals. The type of work dictates the regulatory requirements, ensuring that risks are managed proportionately, from simple awareness for low-risk tasks to full licensing for high-risk interventions. In the UK, asbestos-related work is categorized based on risk level, which directly determines the required controls and whether HSE licensing is needed. Maintenance work, such as drilling, painting, cleaning, or minor removal of asbestos-containing materials, ACMs, is typically non-licensed but still requires asbestos awareness training, a risk assessment, and basic control measures like using PPE and dampening materials to suppress dust. Removal work, especially when part of refurbishment or redesign projects involving higher-risk ACMs, e.g., insulation, sprayed coatings, or pipe lagging, often requires HSE licensed contractors who implement stringent safety protocols, including enclosures and respiratory protection. Encapsulation, applying sealants to bind asbestos fibers and prevent release, is a control method used when removal isn't necessary, but it still demands trained personnel and ongoing monitoring. Finally, air monitoring and sample analysis are specialist activities conducted before, during, and after asbestos work to verify airborne fiber levels and confirm material types. These must be carried out by competent, often accredited, professionals. The type of work dictates the regulatory requirements, ensuring that risks are managed proportionately, from simple awareness for low-risk tasks to full licensing for high-risk interventions. In the UK, asbestos work is divided into licensed, non-licensed, and notifiable non-licensed work, NNLW, based on the material type and risk level, as defined by the Control of Asbestos Regulations 2012. Licensed work involves high-risk asbestos-containing materials, ACMs, that are more likely to release large quantities of dangerous fibers when disturbed, such as sprayed asbestos coatings, loose-fill insulation, asbestos pipe lagging, and severely damaged asbestos insulating board, AIB. This work must only be carried out by HSE licensed contractors who use full containment, respiratory protection, and air monitoring. In contrast, non-licensed work covers lower-risk tasks involving more stable materials like asbestos cement, e.g., roof sheets, gutters, textured coatings, such as Artex, and vinyl floor tiles, which can be handled by appropriately trained workers using basic controls, provided the material is in good condition and not significantly disturbed. However, some non-licensed tasks, like removing large areas of textured coating or working with slightly degraded AIB, are classified as NNLW. They don't require a license but must be notified to the HSE in advance, involve health surveillance, medical exams, and require clearly marked work areas and proper record keeping. Understanding these distinctions ensures that the right controls are applied, protecting both workers and the public from avoidable exposure. Effective planning is essential before any construction, maintenance, or refurbishment work begins. Never start a job without first assessing the risk of asbestos exposure. Always check the building's asbestos register or management survey, required for all non-domestic buildings built before 2000, to identify the location, type, and condition of any asbestos-containing materials, ACMs. If no records exist, you must assume asbestos is present, especially in buildings constructed or refurbished before 2000. Ask, can the work be done without disturbing ACMs? If not, determine whether the task requires a licensed contractor, e.g., For high-risk materials like sprayed coatings or insulation, or falls under non-licensed or notifiable non-licensed work, NNLW. Use correct equipment and methods, wetting materials to suppress dust, using HSE-approved respirators and disposable coveralls, and avoiding high-speed tools that generate dust. Never sweep asbestos dust or reuse disposable PPE, as this spreads contamination. Finally, asbestos waste must be double-bagged in UN-approved containers and disposed of only at licensed disposal sites. Following this safety checklist isn't just best practice, it's a legal duty under the Control of Asbestos Regulations 2012 and the key to preventing life-threatening exposure. Identifying asbestos in properties requires caution, as it is often hidden within building materials and cannot be reliably recognized by sight alone, especially since it may not appear on original building plans or may have been added during later renovations. In residential buildings, particularly those constructed or refurbished before 2000, common asbestos-containing materials include pipe lagging in lofts, asbestos insulating board, A.I.B., panels and airing cupboards or behind radiators, vinyl floor tiles and adhesives, textured decorative coatings like Artex on ceilings, and asbestos roofing felt on garages or outbuildings. In industrial or commercial settings, higher-risk materials are more prevalent, such as sprayed asbestos fireproofing on steel beams, thermal insulation on pipes and boilers, pipe and valve lagging, A.I.B. used in soffits or ceiling tiles, and asbestos fire blankets or gaskets. Because asbestos can be present in unexpected places and in varying conditions, the only reliable way to identify it is through a competent asbestos survey, either a management survey for ongoing maintenance or a refurbishment/demolition survey before invasive work begins. Never assume a material is safe without verification, as disturbing hidden ACMs unknowingly is a leading cause of occupational exposure in the UK construction industry. Under the Control of Asbestos Regulations 2012, certain asbestos-related activities classified as notifiable non-licensed work, NNLW, such as removing textured coatings over a certain area or working with slightly degraded asbestos insulating board, A.I.B., must be formally reported to the relevant enforcing authority before work begins. This is done by submitting the online form ASB NNLW1 to either the Health and Safety Executive, HSE, or your local authority, depending on the type of premises, e.g., HSE for industrial sites, local authority for domestic properties. Importantly, notification allows work to proceed immediately, no waiting period is required, but it triggers legal obligations. Employers must keep detailed records of the work for at least 40 years, ensure all involved workers undergo mandatory health surveillance, medical checks, and implement specific controls like designated work areas and proper decontamination. Compliance with these reporting requirements is not optional, it's a legal duty designed to monitor exposure, protect worker health, and enable regulatory oversight. Failing to notify NNLW or keep proper records can result in enforcement action, fines, or prosecution, underlining why strict adherence to notification protocols is essential for both safety and legal compliance. Asbestos remains a serious, long-term health hazard in UK construction, but risks can be effectively managed through awareness, proper planning, and strict compliance with the Control of Asbestos Regulations 2012. All workers must understand the type of asbestos work they're undertaking, whether it's licensed, high-risk materials requiring HSE licensed contractors, non-licensed, lower-risk tasks with stable materials, or notifiable non-licensed work, NNLW, which demands advance notification, medical surveillance, and record-keeping. Always consult asbestos surveys, follow HSE-approved task sheets and safety checklists, and never assume a material is safe without verification. Protecting yourself also protects colleagues, clients, and even your family, as fibers can be carried off-site on clothing if hygiene controls are ignored. Finally, asbestos waste must be double-bagged, correctly labeled, and disposed of only at licensed facilities, never in general waste. By embedding these practices into every job, the industry can prevent exposure, uphold legal duties, and save lives.